I want to be the voice for the unheard. I want to be the voice for those who don't get seen. And if my little presence in this earth can help one, two, three people, then I've done my job.
Oh, this is major. It's like the next big thing. Come
Greetings and welcome to the Compromised to Alchemized podcast with me, your host, Dr. Neil Bolson-Donnie. I'm here in Sherman Oaks and practicing out of Ina Henry's office. That's why you will see lactation consulting and nursing. Well, you'll see breasts. Obviously, you do. So it's because I got the great joy of collaborating with her and working in her office on certain days when she does house calls or other things. And the cross referral is amazing. I'm going to be interviewing her soon on the podcast. She's an amazing IBCLC that not only does LA visits, but also she does virtual care. So that's how we first connected when I would take trips to the Bay Area. So that is where I'm at. I'm also on a renewed purpose. I am going to be talking a lot more about the tongue. That might sound like, for those of you who know me, that might sound obvious. It also might sound like old news. But I'm going to have fun because I've been leaving out the elephant in the room. I've been going past the tongue to talk about the oral diaphragm, to talk about the floor of the mouth, to talk about the pioneering work that I've done with the floor for phase shift and functional mandibular diaphragmatic integration. While that is all fine and good, I've been leaving out my innovative and pioneering work with the tongue. And I'm like, everybody's talking about it. I don't need to talk about it. And then I realized, you know what? No, because the discoveries that I've made with a range of issues are not being covered in the perspective, in the way that I'm talking about them from a manual therapist perspective who's looking at extensive change and extensive results without very little effort needing to be put on the tongue itself. So let's get to that later. Right now, it's all about Kelley Rubio. She's on the podcast. I get to interview healers, artists, thought leaders, all kinds of people on the podcast. She is an RDH and also a myofunctional therapist. She's got other certifications, and you'll look at the link in bio or the link and all of her links, and you can read more about it. But who is she? She's a myofunctional therapist. And I would say, so we've had so many great conversations, including the podcast one. And there is so much to say about what she knows. I would just have to say, in addition to her bio, she is an advocate. She's really knowledgeable about female health, and she'll go into that. But she is the founder of My Myo My Health, an airway-focused therapy and wellness practice in Phoenix and Mesa, Arizona. She's a U.S. Army veteran, registered dental hygienist, and qualified orofacial myologist. Kelley specializes in myofunctional therapy, Buteyko breathing, craniosacral fascial therapy to help clients breathe better, sleep better, and become their best selves. Living with Ehlers-Danlos Syndrome herself, she brings a rare firsthand insight to the work with hypermobility and EDS in that community. She's also a passionate advocate for women receiving equal, fair, and humanized care in healthcare and the airway world. We've jammed on that. We've had so many, I'd say, conversations talking about advocacy for what is not right for the people that are not being served well, which is, of course, women and others. So I am so excited for this conversation. It was really great, nourishing. I feel like Kelley's somebody to learn from for a lot of us. So get ready. You're going to be wowed by the goodness of this interview. And you're listening to Major by Jessica from Luna Lux. Amazing song that just totally resonates with the ethos that Kelley has and me as well. So enjoy it. Share it with somebody you know needs to hear it, and I can't wait to hear what you think.
You know we doing it big. 'Cause this is major. This is major.
All right, Kelley, I'm excited to have you on the Compromised to Alchemized podcast, and it's been good to have some chats via Instagram, and like that feels like alive, and it feels like there's a lot of resonance. So it feels like we have really met before, but this is the first time that we're meeting face to face. But it's been
Yes.
fun to chat, and I'm happy to have you on.
Yes, thanks for having me. I know we have a lot of mutuals, and there's
Mhm.
always Instagram that pulls us all together in this space, isn't it?
That's right. Thanks to the IG. I
Yes.
look at that as a great mechanism and medium. And yeah, that's great. And it's also like the desire for people to connect and to link up. It's like Instagram is our medium, but the desire to connect is deeper. But also, I've been a fan of your thread and your, seeing your info that you put out, and I care a lot about a lot of the things that you share about across the spectrum of
Mhm.
physiology and the body and the struggles, to just talking about the desire to see the feminine polarity in women, see this the shining moment that, anyways, I feel like there's so much to talk about with you that um and I want to delve into so much. So just happy to have you on. And yeah, I came to Phoenix last summer to do an event, but we didn't get to meet. I'll be back there um, in September. So I'm hoping we get
September.
to meet. Yeah.
I know.
That'll be
I know Dr. Lee was on your podcast and
Mhm.
Dr. Stella, and they're lovely, lovely women. And, they think very highly of you. And I'd love to be able to swing by and meet you in person because it's just
Yeah.
different energy. But yeah, I feel like when you come across people on the gram, it's interesting how you do have an energetic exchange and you do feel that energy through social media, which I didn't know if I believed that 5 years ago, but
Mm.
it's almost like instantaneous. It's like, yeah, I align with that. I jive with that energy, and so I appreciate you asking me to be on because I feel like I could be a little more open on your podcast about what I align with and how I
Mhm.
deliver therapy in my practice, looking at the whole person and
Mhm.
also honoring the women's body and what we've been through as a woman in
Mhm.
regards to pregnancy, loss, what we have to carry on our back our whole life, the load of what we have to manage in our household.
Mhm.
And honestly, our biology is completely different. And when I am in a healthcare science based field, it's not necessarily looked at as that. It's
Mhm.
been years and years and years of research specifically for men with
Mhm.
sleep and breathing and, discussing what markers are there and what the protocols look like are have been for decades have always been based on a man's biology. And
Mhm.
so that's why I am ready to just shout it out because those of you who are in the age group I'm in, I'm 46, you just stop caring. You stop caring what people think and you can become like your true free self. So when we talk about alchemizing, it's definitely like that's the theme I think of midlife is
Mhm.
you
Mhm.
have this journey of where you started, like my example is in my birth order, I'm oldest daughter.
Mhm.
And that comes with a lot of responsibility from day one. You don't ask for it, it's just put on to you. And then look at the career I chose. I was in the Army, it's a service based career, and going forward, you tend to, especially my generation, Gen X, you do want to be that yes, yes, ma'am, yes, sir kind of person.
Mhm.
And how I've shifted of leaving dentistry and opening up my own practice where I could fully engage with my patients as a whole in their entirety of what's going on. um, Gosh, it's made my life so much better. And
Yeah.
I feel like I'm living the alchemy of
Mhm.
where I came from to where I'm at now. And I just want to tell if you're scared of midlife women, don't be scared. It's freeing. It's freeing not to care what people think. It's freeing to be able to express your thoughts, your feelings, your desires, and not have that part of your brain that wants to hold you back. And
Mhm.
it's a lovely place to be.
Yeah, I love it. And I'm 46 as well. But yeah, I love that you're shouting it out. Because as I can say that it's a passion of mine or I care about it, or it's like it's even weird to say that, right? Because it's like, why are we needing to? But we are
Yeah.
because we are, because of the systems that exist and because of the ones that
Mhm.
need to be toppled. So that's
Mhm.
all true. So, but what I can do is come alongside you, come alongside my wife and others who are the ones who have been experiencing it. I can support, but I can also speak, because if I don't speak and just support, then I'm not really advocating. So I said a
Right.
lot, and those who know, but anyways, I want to make sure that I am emphasizing that, like, there needs to be a place to be where you can share, and we hear all of us. I'm excited, and you're right. Well, you spoke to the theme of midlife being the alchemy time, and to speak
Mhm.
to the theme of this podcast, one half of it is compromise to alchemize, is about, like, from struggling to suffering to alchemy, which is like healing
Yeah.
and gold and integrated. But it was
Yes.
earlier today, I was thinking about compromise, even from another facet, which is like, how often do we make compromises, to
Mhm.
abdicate our voice, to abdicate our bodies? Women do it all the time. And it's like, I'm not cool with that. I mean, I'm not, this is again, not to meant to be directed at women. This is more like, you're all like, offering your bodies to bring into the world these beings, these babies. But it's not just that. It's like, so compromise looks to me like we're compromising our data because we're not
Mhm.
recognizing female stats profiles, and like how that should inform our research 100%. And then we're also like seeing, like, my hope is that, like, y'all would need to compromise your own sake of well-being and health. So this is the time for that to just get belted out there of, like, let's right this ship. Let's bring equality and balance and homeostasis, not just to our bodies, although we need that
Right.
in the micro and in the internal. We need the systemic balance and homeostasis that's there. So I feel like I'm excited for you to come on to, you know
Yeah.
so I'm gonna pass the baton or the proverbial mic to you to say, like, how has that been something that got emblazoned in you? What made you, like, have that fire to share like that?
Yeah. Well, the compromise, as what speaks to your podcast name, Compromise to Alchemize, is, we all look at where we came from, and that molds who we become, and that molds who we are, and that molds what we do as a profession. So, growing up, having a lot of strife and struggles and not being in the right socioeconomic bracket, and, having our lights shut off and witnessing, the death of my brother in his sleep. And,
Mhm,
it just kind of goes on from there. I don't want to be super depressive. It kind of goes on
mhm,
from there, and then
mhm.
holding all of that, because at that time in the 80s and the 90s, you don't go, "Hey mom, I'm feeling sad, can you help me?" I mean, that's way different now, right? You don't
Yeah.
have people like you that you can say, "Hi, Dr. Neil, can you help my nervous system and energetically help support me, and, touch, put your hands here so you can
Mhm,
help me with regulation." um and I know that's why I found what I do now, is because I am speaking for that little girl that didn't get to ask the questions and didn't get the support for healing. And having to find that on my own
mhm.
makes me want to advocate for people who don't have resources and don't have the voice and don't have the awareness and the knowledge to do so. So, when you're compromised, you have to find resources. You're not just going to live compromised. So, if I wasn't sleeping well, which I didn't, based on what, the circumstances were, but also anatomically, physiology had something to do with that. And going through life just always, 75% on, because I was so tired. I didn't sleep well. And that spilled over into becoming a mother at 20, and how I cared for my children because I wasn't sleeping well. I had horrible postpartum. I couldn't breastfeed my kids, didn't know what else to do because I was overseas in the military. And at that time, here's a bottle.
Mhm.
I don't think people realize what that does to a mom that really, really wants to breastfeed. and is taken away from that right that we should have to be able to breastfeed. I
Mhm.
wanted to be able to feed my children. That's one of, what I should be able to do as a compromise because it
Mhm.
was horrific and painful and I wouldn't wish that on my worst enemy, but I didn't have anybody advocating for me. We
Mhm.
had people around us. I had my mother who had a ton of kids and is a nurse, and it's just like, toughen up, toughen up. When should care look like that for anybody? Like, when should care just be, you know what, you're just going to have to toughen up and that's how it is? Like, that shouldn't be what we're telling women. That shouldn't be the norm and a standard. And so that's where my experience comes from, is being told, suck it up, this is
Mhm.
life. Suck it up, this is life. No, I don't want to live like this. I'm sorry, but this isn't right. I don't feel good. I don't feel good because I'm sucking it up. And then time goes on and jaw pain and migraines and idiopathic migraines because nobody could figure it out. And then I'm in dentistry and I'm
Mhm.
working with kids and I'm, seeing the high volume of children that are coming in over the decades, because I've been doing this since the 90s, that their mouths are getting smaller. And there's more patients that need wisdom teeth out. And also, interestingly enough, more patients that didn't even have wisdom teeth
Mhm.
because evolutionary, we don't have the space. And I was one of those. I had one and my kids had none. And my family's genetics comes from England. So there's that.
Mhm.
And knowing that this isn't right and this isn't something that we should just accept based on my experiences in healthcare and otherwise. And then one day I was just, hey, what's going on here? And I happened to have a serendipitous moment where, taking care of my niece and nephews, hearing him snoring and hearing him struggling to breathe in the next room, because my kids have oral dysfunction, but it
Mm.
presented different.
Right.
My brother's kids all had the very narrow, long faces, speech issues, breathing issues, allergies. My kids were the clenchers, the grinders, hold it in, hold it in, hold it in. And guess what? That comes
Mhm.
out in personality. And that's kind of who you become, because I was clencher, grinder, hold it in, hold it in.
Yeah.
And I said, this isn't right. I haven't seen a child snoring and lips turning blue. What's going on here? Led me to do some more investigation, plopped in a course, and I was like, holy cow, like, hit with grief, because here I am seeing all these children my whole life, living this experience that they're talking to us about airway dysfunction, with myself and my own children, and so angry. That was like, the walls split, the sun came down, and I was just like, why? Why aren't we talking about this vital sign of sleep
Mhm.
and breathing? And especially as a mom that had significant postpartum, that, compounded into, when you're not sleeping, what's going to happen to your brain? You become depressed. And
Mhm.
no, in my situation, nobody was advocating for me, listening to me. Oldest daughter, figure it out.
Mhm.
So that led me to where I'm at now. And then over time, I have, if you follow me on my socials, I've had a recent diagnosis of having hypermobile Ehlers-Danlos
Mhm.
postural orthostatic tachycardia syndrome, mast cell activation syndrome, ADHD, autism, perimenopause. I mean, you name it,
Mhm.
it's there.
Mhm.
Why is it there now? Is it the trauma? Is it not being heard? Not being heard my whole life? So I'm using that because I had to find this out myself. I I would have gone until probably I died early from dementia, like the rest of my family, and not known. And so I want to be the voice for the unheard. I want to be the voice for those who don't get seen. And if my little presence in this earth can help one, two, three people, then I've done my job, because in speaking out for those who don't have their voice.
Mm. Yeah. First of all, so sorry for you not being advocated for, um,
Thank you.
and in the grief, and all the loss, both, well, all kinds. So
Yeah. Yeah. Thank
there's
you.
that.
Thank you.
And I'm very also not happy yet. Not happy yet. I'm very sorry for what you're facing, and
Yeah.
these recent diagnoses and journeying with many people over many years. I either know what those are really well from journeying with people or know
Right.
someone dealing with that, but it's a lot altogether. That's a lot. And yeah, you
Mhm.
touched on some really deep connected areas of like, what about the trauma? What about those things and the connection to those things? And then I'm really now I'm happy. Now I'm happy because you're speaking up. And I'm so thankful because you're speaking up that you will reach people, that their lives will be changed. And because
Yes.
of what you know, even though I'm getting to know you, but I know from following your work, I know
Mhm.
from those with whom you collaborate and from some of the stories of those you've helped, because from your work in dentistry and then yet the myofunctional therapy and the craniosacral fascial, there's just words, but there's way more that you do on even journeying with people in that the emotional space and the nervous system
Yes.
regulation space. You bring a lot of resource, and you're going to, of course, before you even meet somebody, they'll see your page and they're going to be in a good way walloped by the help. So
Yeah.
I
Yeah.
just know you definitely exude advocacy, and so happy that you're doing that and that you're sharing
Thank
out of
you.
that place.
And same for you. I know you work energetically with your clients, and that's where I feel there's a difference in the delivery of care. When you're in a healing profession, you're a healer. And if you look at the history there,
Hmm.
what comes with being a healer, it's also minding the energetic exchange of
Hmm.
working with the person on the other side that's receiving it. But guess what? We're also receiving that energy. And that exchange is beautiful, in my opinion.
Hmm.
And that's something I didn't get from mainstream dentistry. I did, I got a taste of it and
Hmm.
I wanted more. And that was another reason why I am an entrepreneur and I feel like I am at heart because I want to craft my own world and my schedule and my time. And I want to be able to spend time with people and make them feel heard and valued. And um, unfortunately, you can't do that in mainstream medicine and working with insurance. And I hate that because it's access to
Right.
care. But going back
Absolutely.
to that energy part of it, it's so important that you're mindful because we're all just energy at the core of who we are. We're all just energetic beings. And if you're not minding the exchange, your outcome of what you're trying to do is going to look a lot different than somebody that is aware of that part of what you're doing as a healer.
Hmm. Yeah, it's such a poignant topic. Like inclined to say, like, okay, we could go to the talking about the dentistry, talking about so many topical things of what you mentioned and all of that, and we can the myofunctional part, and yet the energetic part is such a significant undergirding principle of existence and then of healing, and of course, like you're saying, like that's what we need. So I would love to know that, like, for you, when did you lay a hold of that awareness of
Oh,
how, yeah, how did that come to you? How did you know that, or how did you stumble across the awareness of it, and then
mhm,
how it was going to then come through, first of all, just for yourself, but then of course come through
yeah,
you for healing for those with whom you're spending time with and journeying with.
yeah. It's really your modality, Dr. Neil, is what shifted in my own journey of healing.
Mhm.
And, I didn't mention this before, but, working through my PTSD, my trauma, and a lot of that came from the military. Um,
Yeah.
no resources once again.
Mhm.
Going through the myofunctional therapy myself, working with peers and the breath work, that was almost that first part because breath is so much of that energetic movement that
Yeah.
changes things, that shifts things. If you have really heavy, heavy, fast, quick energy, you're breathing heavy, fast, and quick. The stillness comes from breathing slow. You need to feel safe and still. You're still if you're safe in order to heal. And so the breath work, becoming a Buteyko certified educator was
Hmm.
monumental and pivotal in my own life. And I knew that was something, but I didn't know
Right.
what it was called. I
Yeah.
knew how to harness it and I knew it made me feel good, but I
Yeah.
didn't know what that was called, right? So then back when I started Myo, there wasn't the extensive, network that we have now. So I found somebody in my neck of the woods that does craniosacral,
Yeah.
and that was it. That was like, something's going on this table that
Hmm.
I have never felt before. And the hands on your body that make you feel safe and comforted, I had never ever felt that. And so taking that like feeling off the table and going, "Oh man, I'm missing something here," working with the myofunctional component, the breath work, but there's so many clients that I have that need this,
Hmm.
because if they're not breathing, sleeping well, especially as, you go into midlife, you're carrying so much crap on your back and you've never had anybody to hold it.
Hmm.
And so you need somebody to literally hold you and guide you through that I almost envision it like a door. And that
Hmm.
door has this, light coming out of it. It's like, come over to this side. Feel how it feels to tap into regulating your system and what healing looks like. And when you can slow down and feel that, that's where I get that from. Is
Hmm.
that was a huge shift in how I navigated my life. My anxiety was way down, and I just wanted more and more and more of it.
Hmm.
I wanted more and more of that feeling. So, moving into, looking at practitioners that could work alongside us in our practice and help those who I felt, and I feel like, and this is a little out there, but I always feel
Hmm.
like I can pick up on people's energy and that helps me open up a conversation.
Yeah.
And having that conversation about what healing truly looks like in the whole person in its entirety also involves having somebody tap into your nervous system and letting go of
Hmm.
what doesn't serve you moving forward. So when you're working on healing and you're working on your sleep and you're working on your whole system in regards to why people seek us out is chronic pain, jaw pain, mouth breathing, and sleep issues. You're up here when you come in like that. Now you can go through the biomechanical process of rehabilitating what your body does. But if you're still storing a lot of energy around those feelings that you used to have of being tired, of just feeling like you're running on empty, that shift won't happen for you as profoundly as if you were to go through a healing journey energetically as well. And that does involve an exchange with a healing practitioner and taking that load off of you. So going forward, I know that I need to connect with my clients' patients on that energetic level and either pour in or pull back based on what they give me. It's like their body tells me, I need this, or I
Hmm.
don't want this right now, but I would love you to do this or talk about
Hmm.
this, and you just sprinkle it in, because we have women that come in. We were just discussing a case this morning that's almost 70, and you get angry. You probably do the same thing, and it's a lot like to take home, because you get angry of seeing these characteristics and seeing it yourself. You're like, they've had this presentation probably for 30 years and nobody's ever mentioned it,
Hmm.
because nobody has the energy to care enough to exchange that with them, because we're all just hustle, bustle, hustle, bustle. You have to look outside the box, and if you truly wanna help people, you have to be willing to ground yourself and help them unload and unpack what they may not even know that they have.
Yeah, absolutely. Yeah, and you said a whole mouthful, pardon the pun, there. That was really good. And so you did. You spoke to, I think, the I was saying there's an 81-year-old who I saw the other day. Well, I've
Mhm,
seen that person before, and they're navigating with some really great sort of therapies and care. And in one way, the emotion I had coming away from that was like not sad or grief, but just like what could have been, not for this person. In fact, this is almost not the best example, but it is in one way. In that, you know, this person has lived a very great life. They're very ambitious. They have uh not that this relates to yeah, they were very much speaking out against war, and had enough energy and resilience to speak out against family patterns that didn't agree
mhm,
with that. And so this person has thrived and traveled the world. Yet I look at what the person goes through, getting how many hours of care to work at problems that were coming from floor of mouth, tongue,
mhm.
palette. And so I realized, wow, all that work is good, yet and she's doing really well with what she got. But in like a short period of time, we found some roots to help her in a way that her body's never experienced that. And I thought, what could have been if she didn't have to go the 81
Oh,
years
yeah.
without that? But she's one of those that's had the energy, the vigor, the resilience, and there are many others I can think of who didn't, that I could bring up right now. But let's just
Yeah,
say
yeah.
that's an example of somebody who's thriving and they've been able to overcome in spite of. But there's so many, whatever age they are, infants to then
Yes,
and older, who
yes.
they don't have that. They didn't come into this world with that genetic nor validation surplus, nor environmental surplus or socioeconomic surplus.
Mhm.
So they may not be this age. They might not make it to where this person made it.
Yeah,
They may not have any of the successes or the overcoming, and not to their fault. But yeah,
right.
so that makes me angry when you say that, because I'm like, well, yeah, I do have those things where I can reflect and say, oh, but I think where my passion lies. I'm gonna read it because
Mhm,
like I told you, this is what I'm really excited to talk to you about. You have this great, I've already read this, so you've already heard this. Everybody, you're hearing this
mhm,
for the second time. You know that, but it's Kelly dot 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 is a passionate advocate for women receiving equal, fair, and humanized care in healthcare and the airway world. And I think healthcare needs it. And yet also we're part of this, you're part of this airway world.
mhm.
Boy, does it need it. So can I ask you to speak to what does that provoke within you,
Yeah,
that
yeah.
when I say it?
Well, just to start off, as recently I was asked to speak or apply to speak at a big airway convention, and I mentioned I wanted to talk about women's hormones and how it
Uh-huh.
affects their sleep and their breathing. And I was told it's too niche and we would
You
rather
mean
have it
women are
be,
too niche? That's
uh-huh,
ridiculous.
and
Okay.
we'd rather have it broad to encompass the whole audience.
Okay. Right. And
And
all of you were
I
born from women. I'm sorry, I'm getting mad.
no, we're all, I mean, everybody on earth is
Yeah,
from a woman
right.
or is a woman, right? So, like, that, I was like, "Okay,
Mhm.
choose me, don't choose me," but, like, that doesn't align with where I'm at, and that's a big part of it, Dr. Neal, is I am so far off of what other myo practices are doing
Mhm.
that I have been told I'm too much. I have been told I'm too intense. And you know what? Keep telling me that because nobody's ever told me I'm not good. Nobody's ever told me I'm a
Mhm.
horrible myofunctional therapist. I would say I'm the best myofunctional therapist this side of the Mississippi. So, why is because you have to care. You have to care. And if you don't care, then shame on you. Do taxes for a living. I don't know. But going back to that, the women's health advocacy and healthcare and an airway care is so behind the times.
Mhm.
We are still like stop bang questionnaire. The stop bang sleep questionnaire will deduct you a point for the G being gender, and you'll be not considered because you're a woman. You get a point off. So what is that? I mean, what does that
Mm.
say? That's a
Yeah.
standardized questionnaire about sleep. Sleep studies, they're looking at AHI, apnea hypopnea index. Typically, women are going to have more arousal data, and
Mhm.
that's what makes them more tired. But the industry is consistently telling women that they're fine because they're not stopping breathing multiple times an hour. They're they're arousing because their airways collapsing multiple times an hour, and so they still have a higher comorbidity rate of cardiovascular disease and dementia and Alzheimer's because of those arousals.
Mm.
But are they told that that's a concern and a risk factor? Absolutely not. I take so much time in my appointments because I'm telling them years and years of science and data of what they should have been told from
Mm.
day one.
Yeah.
And the other part of that is hormones, cycles, and menopause, peri, and post are not considered at all in a myofunctional program, at all.
Mhm.
And that pisses me off too, because when you're working, who's your client base? Kids and women.
Yeah.
It's husbands, partners,
Mhm.
I love you, but you gotta fix yourself too. But guess
Right.
what? You receive better care. So, I still care about you, but I am
Yes.
going to advocate a little more and
Mhm.
harder for
Yeah.
these women that are being told nonsense, and they
Mhm.
believe them and they believe them. And so that's where this comes from. This comes from my own experiences too, as a woman receiving subpar care and not
Mhm.
having a diagnosis for 20, 30 years and not knowing who I truly was and what was wrong with me. And then the validation that ensued from there. I can't tell you how many times I've been told I'm crazy. It's in my head. Take these depression pills. So
Mhm.
that's what's coming in to see us, and it's not a joke. It's actually almost every single woman that comes in here with sleep issues and jaw issues. And then you look at the economic hardship of how much money have they spent to get to here? And how much money have they spent on night guards and splints? And then the pink tax. We talk about the pink tax being, what do I have to pay extra to just feel okay? Every
Mhm.
month when I get my estrogen patches and my vaginal estrogen suppositories and my testosterone cream and all the things, I'm like, what the hell, man? Like this is a lot of money just for me to be normal. Just
Mhm.
for me to be normal. And that it goes on and on and on from there. So when somebody comes in, I'm going to talk to her about their hormones. I'm going to ask them, especially if it's a younger girl, like a teenager, do you have a cycle and how frequent is it? Did you know you're supposed to have a frequent, consistent cycle? I can't tell you how many girls have come in with irregular cycles or not having a menstruation cycle for months and months and months and have been told by their pediatrician that's normal.
Mm.
That tells me their system is off. And you've
Yeah.
seen this when you lay your hands on them. Like that tells us that their nervous system is something's out of whack. And we
Yeah.
need to stop saying okay and nodding our head and saying, you know what, I'm going to go find somebody that will explain this to me.
Yeah.
And it stinks because it's going to cost, and that's just the reality is it's going to be a financial burden for women to find out what's wrong with them and then also to support what they need to do because it's going to be more than a man just to feel normal. So when I have these clients and this client type, this phenotype, we cover everything that could be in the way of what's getting in the way of them feeling good in their body, their sleep, their breathing, their hormones. My mouth's dry because I am in perimenopause and estrogen is the driving force of mucosal hydration. And if your mouth's dry, Guess what else is dry? Your gut, nether regions. And so, what does that quality of life look like? Has that been explained to women? And they come in, oh, my mouth's dry because I keep my mouth open at night or I'm mouth breathing. Well, it's extra dry because you're 45 and nobody's talked to you about your hormones. And that's why you're breaking teeth and needing root canals and needing your fourth filling on your back upper molar. So I hope that answers your question.
Oh boy, it
That was
does.
a lot.
Well, I'm saying, yep, yep, just getting me started. And but no, it's a lot. It's a lot. Right away, I'm like, oh yeah, you've clearly like you understand from on a technical research based like science level what's been missing sorely. And then you
Yeah.
also bring in your empathy and your understanding. Not to touch on or not to skip actually from earlier, you speaking about energy and working empathically, and that is very much
Yeah.
the foundation of my work is intuitively, empathically, and I'll let people know. I'm like, is it okay for me to feel what you're feeling? Usually I do, but sometimes if I don't tell somebody and I haven't
Yeah.
felt yet, then all of a sudden if I'm working with them and unlocking layers, my tongue gets dry and I'm like, oh, just a second, are you
Mm,
is your tongue dry? And then they're like, "Yeah." And I'm like, "Oh, okay. So you're experiencing a mild Herxheimer or detox reaction. Let's slow down and let's navigate that. Let's give you some minerals or
yes.
let's just take a pause." And then I can feel the saliva come back. I'm like, "Are you feeling saliva again?" They're like, "Yes." I'm like, "Okay,
Mm,
good. Then we can continue." But then
mhm,
I say, "Okay,
mhm.
so is it okay to feel into more?" And I'll bring it up if I will, because I wait for permission.
Yeah.
But feeling what other people feel is a something that I've known to do, or it's just come to me from early on. And then as I've
Yeah.
just learned to practice it more or be okay with it or accept it, I know that is part of what we're tapping into with engaging in the feminine polarity of like flow, intuition, but it's just doesn't even need to be called anything because but that's the energy part and that's the empathy part. But you're also carrying the bedside manner of
Yeah.
empathy towards people, care and compassion towards people. So two amazing things about you, although there's millions. And then you also are fiery in your advocacy to inform. And I think, yeah, I've seen so many women come in and it's like I'm glad that now there is more out there in terms of like finding experts on perimenopause, but it's like, why should we have to have you go through and rifle through and I've been like, wow, I should have known more about that so I could have understood that those changes in hormones or why your fascia was rigid there or why you had that hypermobility transiently at least. And I'm like, ooh, so I crave to know more and I want to know more and I'm going to learn from you more and from my wife and others. But especially when we're talking about clinically relevant within airway, it's like, yeah, it's
Mhm.
so important. And so I get really like I'm like,
Amped up.
yeah, how do
Mhm.
you know, to that statement earlier, I'm like, I get it. There are agendas and there are things, but I'm like, totally. Yes, you may not want to have a topic talked about at an event because it may not fit into what is the tenets of this event. But can we look at humanity and not have cognitive dissonance? Can we
Yes. Yeah.
resonate cognitively and have cognitive resonance and say, we all came from women. Therefore, women's hormones are important. Therefore, how can we talk about any of this if we're not mentioning the elephant in the room? And it's not an elephant,
Yes.
it's reality. So, part of me never left that moment in our conversation where you shared that
Mhm.
because I was like, oh,
Mhm.
but then of course I went
Yeah.
to like how many women have come in. And I will say some men have come in caring and they're very much in tune. And I've seen this part of them silenced also, where they cared and they wondered about this issue that their baby was experiencing. And
Mhm.
I'm only going to talk about this. I don't like to say it too much because it's been talked about enough, but they were gaslit and naysayed by a provider in a hospital to say, no, your baby does not have tongue tie, or
Yeah.
it doesn't matter. That doesn't matter. It's not really a thing. All the reasons why it's a fad. And yes, you just need to have your wife or you deal with it and just deal with that. It's gonna be fine. And it's like, no, that is not
Mhm.
okay. I've seen how
Mm.
much struggle and suffering that is for both the baby and the parent when,
Yes.
and not to mention the emotional and just the straight up no way. Like you can't. It is not okay to invalidate anybody, and it's not okay
Mm.
to invalidate someone going through an experience. Now, of course, we know if we get really into it, we know that some hospitals are giving gag orders where they're not
Yeah.
allowing their lactation consultants to talk about this. And you may know other people, and you may be one of these people who has the code where I didn't develop this, but in the city I moved from, lactation consultants knew that they couldn't say anything, and so they would say, "Just go see Dr. Neil." They
Mhm.
would learn to say that because they would get so much flack from their superiors, which maybe they were men or women, but it was a patriarchal colonial, it was a negative
Yeah.
structure of suppression. They just knew that they couldn't fight that. And I think it's wise for them to know that because yes, we should speak up against, but some structures they will
You can't.
suppress more.
Yeah.
Yeah, anyways, I'm going down that rabbit hole of like that, but I'm how many people have come in saying that they've had that experience and I'm like that is not okay. You should have never been told those things. You should have been told those things. And first of all, you should have been treated with kindness and decency. And
Mm.
anyways, some providers I even made me know who they're talking about. And I'm like, wow, they care. But yet in that moment, they abdicated their own sense of care for a person and
Mhm.
they went with the system instead
Yeah.
of what they care for. And I'm like, well, in that case, we really need to hold ourselves to higher standards to continually seeing what is going to benefit the person in front of us. And even though in times in the future we may not need to the pendulum swing, but we need this pendulum swing hard because like, what about those who will say, "Well, men need health too," and yeah, like you're there for them, but women have been lacking the right
Suppressed.
honor,
Mhm.
care, and deference.
Yeah.
So we need to overcompensate because that's not even overcompensating. That's just saying enough, and we need
Yes.
to say more. And eventually,
Right.
maybe we won't need to say this much. I'm gonna then digress and give the mic to you again. So
No, I love it because I hear you and it can't that's we're talking about these travesties that we see as providers
yeah,
and like this is what the toll that it takes on us with our mental health too. And hopefully you have, I mean, I'm sure you do, but like we need to have uh, techniques, tactics, and resources also for ourselves. So we can be that continued empathic, caring provider that I always want to be. So when
yeah,
we talk about the differences with women and men, that includes for me making sure that I'm not put into that role in my household where I am taking everything on. And guess what? Does it happen? Absolutely. Because I'm a control freak, oldest daughter, Leo. But I'm learning, and this is where men can take a tip here is learn how to care for your partner in a way that they don't say so. So notice men always say, well, you didn't tell me that. But it's everywhere. Why do I need to tell you? Like, why do I need to tell you that the dishes need to be put away? Why do I need to tell you that I'm having a hot flash? I need you to go get me like something cold, something like this. So with men and women, we're very let's do it, let's do it, let's do it. Men, oh well, you didn't give me the chance. But if we stop to listen to each other and really feel each other's
mhm,
energy, this crosses over into every relationship, is that's where we can be more partners and more of a team versus man versus woman or
mhm,
the person taking the woman's role or that
right.
feminine role
Yeah,
of holding everything on
yeah,
themselves. So
yeah,
then what I see with men in healthcare is they get so used to standing back and not knowing enough. Hey, Mr. Smith, when's the last time your son had, or did your son have any difficulty feeding? I don't know. We should know that, Mr. Smith. why did that not be an issue is because mom probably was just so overwhelmed. She's like, "Get out of here. I don't want." That's where we come in and we are one. We help
Mhm,
each other, and that's with every partnership. So men have that also, that there's some issues there because of how much we are not heard. And
mhm,
that becomes an issue with that partnership, especially all of us that have had kids early on. When you first have a kid, your dynamic and your relationship change so much. So if a dad's saying, "Hey, I'm advocating for my wife right here," and they're being told, "Be quiet, you don't know what you're talking about. You're just a dad." It's the same concept is we're not he's not being heard, and
mhm,
he's trying to speak up. Is he going to speak up again in the future? Maybe not,
mhm,
because going back to healthcare provider is we need to, just because it's the dad, we still need to hear him out. He still knows what his family needs, or he's trying. So when we talk about that separation, if we start to listen to each other more and more observation and more exchange of that energy and be open to that, that's where we're going to have more of that equal support in the household. And that's hopefully where women don't have to feel as such that we have to take it all on ourselves. And then
mhm,
going back to having that voice and speaking out and getting the care that we deserve will be more will provide more of that advocacy for our families, part both sides of the coin. And that eases us women, that eases our responsibility and how much we're going through and how much we're feeling as we navigate the world that we live in.
mhm. Speaking as a person who grew up very passive, I had to really work hard at showing up for
Mhm,
myself, for my wife,
mhm.
for our kids. I
Yes.
had to really work hard. I came in with this huge desire and conviction to not do things the way that I saw them modeled, and to be like fully there, present, active, and yet I had to have to work hard at that and show up. And yeah, my wife and I've talked a lot about like how for years we've worked on how like can I how can I take more responsibility so that and we've worked really well, we've worked a lot on that, and I have improved a lot from where I was, not just
Yeah.
having a desire and an intent but matching that with action, because words are words are good and mind in
Yeah.
intents are good, but if I'm not backing it up with action and taking initiative. So the thing I learned to do is I had to learn how to be conscientious towards what she needed and my wife needed, and what we needed, because I need it. I need the balance. If I need more time with my
Yeah.
kids to feel balanced, I need more time doing the dishes to feel balanced. I need more time. I'm not saying everybody needs to do the things that I'm saying, but I like to cook, so I need more time
Yeah.
with my fingers and the foods, so that I can. So it's not about like just doing things to a tally. Because I'm
Mhm.
I'm I'm echoing you and then speaking of what I've had to learn, and the
Yeah.
more I can show up with the initiative, which is actually like masculine energy, to be
Mm.
there, to then be a soft place of support, to then take on more of what's needed to be taken on, so that I can allow more of the right balance. It's good. It's hard. It was hard, and it is hard. But if I'm not working at it, then I'm not advancing, and so
Right.
I'm learning more about how to continually like have the right energy matching the right action, so that I can have us have a um more balanced in one way, like life, home, and yeah, I think that dynamic is such an important one that you mentioned. Oh, it sparked something else, and I'm not remembering exactly what it was, but I think the more that I do that, the more that I see, for me, the more that I see like that's a toll, and I think that's part of what it was. It's yeah, I'm taking on a toll, but why not? And how can I not? Because that is not meant for one person in the
Right.
family to carry. And not only that, I think it's a good example of how like I might not be as good at something because I didn't have as much childhood training in that, but I
Yeah.
can learn.
Exactly.
And so
Yeah.
if we can learn, yeah, we have our strengths and we have our weaknesses. Some things I do really well, and like let's go with that. Let's find that balance of like going with our strength, but it can't be that women are good at everything. Like at the
Yeah. Yeah.
this and that, right? So yeah, it can't be right. So like you're doing the best with, and this is why I give you credit. It's like women are great at doing a lot with what you have and finding ways to make it work. But you know what that does is it compromises and
Yeah.
it taxes you more than it needs to. So I feel like the benefit I had was growing up around my mom and my sister more, so I could see more of like how to do some things and understand some things. But that's way different than me growing up into my own adulthood to then say, "Ooh." So I feel like there's a lot there. Now, how can we say like, do you see analogies of that imprint into health, airway health? Do you see analogies of that into our hierarchical structures within healthcare? Or, and then 5 hours
Yeah.
later, Kelly, you're gonna finish talking, right? So, if you could power pack it into, like, what comes to
Yeah.
you, let me.
Right. So
Oh, no, here's
here's
what I
what.
was gonna say,
Yeah.
Kelly, before I was gonna tongue in cheek it
Yeah.
sarcastically or
Yeah.
satirically interrupt you and say,
Yeah.
like, "Oh, we," because you were mentioning these things that you hoped that I have, and you have. How are ways that we know how to balance it so we're not
Yeah.
carrying the stress? And I'm like, well, Kelly,
Yes.
let me tell you, as a man, I have a 5-step program for you to follow, Kelly, as a woman, on how you can feel better. So I was like,
So
"Oh," like, as a man, I'm going to teach you step one, recognize that you're a woman.
mansplain it.
I'm going to mansplain how to be aware of how much
Ugh.
more of a voice you need.
Bleh.
All to poke at myself there and to make fun of myself.
Right. Right.
Um,
I
any
love
of
that
that,
about
no.
you.
No, that's all that. But yeah, back to you. What do you think about like when we think of like the macro of that interplay when we talk about the
Yeah.
dynamics of that?
Well, it even goes over to what I see is listening to providers and who is the one delivering the message.
Mm,
So if
mhm,
you have a male provider that's
mhm.
tall and big and saying, you need this done, versus female providers who you know and you've had on our podcast.
Yeah.
And historically, what is that relationship here in the States with that presentation is, do they really know what they're talking about? And then you have a big man telling them what to do. Who do they listen to more? So I can read the room and know what I should do and how I should deliver the message and how to back them up 100% all the time.
Mhm.
And that's frustrating. It's frustrating when I am working with women providers that are not being substantiated in their clinical delivery when I know that they're the best clinicians ever, but it's who's delivering the message. There's a pause there. And if I say the same thing, but a male ENT tells them, no, you don't have to worry about that. They don't have a speech issue. They're going to listen to the male ENT.
Mhm.
Up until recently. Why? Because I'm in midlife and I don't give a you know what anymore. And I feel like that has changed the
Mm.
acceptance
Yeah.
of the information and delivery because most women are a little more reserved because we feel as though we have to be polite and careful what they say. And so when I have male providers tell me I'm too much and I wish you were a little, I'd love to refer to you, but well, sorry, I don't care because I am always going to say what's right for my patients. And I'm always going to speak out. And back to your note of, you know, at the hospital, the gag orders, and you don't have a ton of it. Whenever a healthcare provider is so adamant on no, that's not it, I would question their knowledge and where they're
Mhm.
providing their care from because
Mhm.
this is science and it's ever evolving and we have to always be open to what could change in a day
Yeah.
and when somebody finds another solution because science evolves. So, yeah, there's definitely a divide in the authority of the clinician and what they look like and what gender they've been assigned to,
Mhm.
for sure. And that's, I know in dentistry, that's heavy. That's
Mhm.
super heavy.
Yes.
Specifically in dentistry, it's very,
Yes.
there's a lot of change and it has been last 10 years, I would say. There's more, it's more equal if you look at the stats, but it still is that dominated, this man knows best.
Yeah.
So we just have to try better.
Hmm. Yeah. Well, I will, because the we cannot just be, yeah, it's gotta be all of us, and it's gotta be
Mhm.
all of us, and I'm gonna use the terms that can agitate some, but I think most of us are getting this is the way, the lingua franca of the new generation. I
Mhm.
have the privilege of being a man, and because I have the privilege, I don't mean that in a way of like, "Oh, look at me." I mean, like,
Yeah.
hey, if I'm a because I'm that, I can speak more to things, and it's ridiculous that I have that privilege because, like, why should I have more privilege? But I do because of the way the system has been so off for so long.
Yeah.
So I need to be aware of that and to
Yeah.
speak and to make sure that I am really living that and talking with you, I'm going to be more that
Thank
because
you.
it is what is important. And I was talking with somebody about what is consciousness, and we can go down so many rabbit holes of that, and I
Mhm.
do. It's like sometimes it is just waking up. Oh, like being more aware and waking up with our senses of what is around us. And for me, whenever I talk to my wife, even when it's hard and she's bringing up things that I'm like struggling with, and then I'm like, okay, I do see what you're saying. And like, it's like a smelling salt of awakening. I'm like, okay, yeah, I
Yeah.
see a better way. I see more clearly. I see what's possible. With you, I see that too. It's like, it corrals me, and the forces swirling within me, meaning like I was brought into this world by a woman, my mom,
Mhm.
and I
Mhm.
was cared for by an older sister. And that's just speaking very simply about it. Um, you know, so there is so much to unpack there. So
Yeah. There
thank you
really
for what
is, but
you are opening up because um yeah, I feel like sign me up to be a student in this of you, and then like I'm gonna be bring whatever I know and have in like this platform as well, just because I think it's important. Like so if if it was a little offensive for me to joke about a man explaining, it's like some people, I don't think it will be, but for some people it's like, sure, we can recommend things. We need to. Like I have a like
absolutely.
I'm poking at myself
Yeah.
because of how many protocols I have. Like
Yeah.
so
Yeah.
like I
But
have a lot.
I mean,
But we
it's
need it,
it
and
yeah.
it's good, and it needs to be that you understand this too well. So there's some that could say like, what can we? And so maybe I'll speak to this part of like, how do we know what is balance? How do we navigate this as men? And I'm like, well, I just think we need to listen more, but not be passive and be active
Yeah.
and not overbearing and not talk over Kelly any longer because I interrupted you and I want you to chime back in. So,
But guess what? I'm like, "Huh, I didn't even notice." But that's the theme is like we're taught as women, especially my age and older, really, is you are supposed to, listen up, not be heard. And my mom is from Europe, so that's even more like you sit there, your hands up, ugh, and lots of kids, so you just have to, you have to shut up and you can't
mhm,
talk loud because there's too many of you.
yeah.
And I have started to evolve from that and not and say to myself, who's hurting? If I don't speak up, my patients, this 2-year-old that has tonsils the size of Texas and can't breathe, but this clinician doesn't want to touch him or do anything because or even refer out, So this is where we need male providers to understand and learn more about half of the population and truly understand what goes on in our body. And no fault to you guys that we just started learning more about our bodies in the last few decades. And so it's not something that has been taught for years and years and years. But I would challenge you to say, if you read research, look at who the population was. Look at what the cohort looked like. Was it what
Mhm.
gender? Was there gender bias? Especially when we're talking about sleep and breathing, because hormones have and pain. Hormones have
Mhm.
everything to do with that. And if you're seeing a woman that's in their late 30s, never say they're too young to be starting to go through the transition into menopause, because it
Yeah.
starts 10 years before your last menstrual cycle. So
Mhm.
just be aware, and that information is out there. So it's up to you guys to take it upon yourself and learn more about 50% of the people that are coming in and seeing you.
Yeah. Okay. That's good. That's a good call to action. I know there's a lot more I want to ask you about, and part two will be amazing if you should accept to come back
Yes,
on
of
when we
course.
get to do that.
Of course.
But I do want to ask you and you're blazing with this, so I think you've already shared it. But I want to ask you about your personal legend, and just for
Yeah.
context, have you read The Alchemist?
I have not, but
You
since
know
I'm
the
looking at all this, yeah, yeah, I need
yeah,
to.
yeah, but you know that the backdrop of Paulo Coelho wrote this book, and it's a really beautiful allegory. And
Mhm.
there's this phrase that's really powerful in it. And you can let me know if you're sometimes I'll give the 1 minute version of the book. So you can tell
Mhm.
me if you
Mhm.
want to hear that. But I'll start with a question and you can let me know. Um,
Okay.
there's this moment where the protagonist, Santiago, this shepherd from Andalusia, who's in search of his literal treasure dream, he had a dream, saw treasure, looking for it, sells his sheep, goes on this journey, and he ends up being mentored by an alchemist and he finds the love of his life. But in the middle of the story, there's this mystical figure that comes up to him and says, "The universe conspires in your favor when you are in pursuit of your personal legend." And
Love it.
I just
Love
all
it.
time sound stops in that moment. And then that's where this phrase is just really powerful. And legend can mean, like Paulo Coelho defines it, your dream, but he also infers through the book of what's your story? What is the story of your life?
Mhm. Mhm.
What's your legend? What's your destiny, your calling, your
Yeah.
purpose?
Yeah.
What are you put on this planet to do? So if you share that.
That's So, I did talk greatly in detail about honoring women and
Hmm.
really like looking at our ancestors, my ancestors particularly, how, within the culture, so many children, and wondering, did my grandmother strive to be something else and couldn't be because she only knew what having 12 kids was,
Hmm.
and her mother before her. And so my legacy really is to move forward and promote women being
Hmm.
heard, seen, validated, and having better care, and making sure that we have that voice that we deserve to have, and we we understand what we need to do differently for women
Hmm.
based on looking at the past and my
Hmm.
ancestors, and were their choices, where was their support. So I
Hmm.
would say that that really is the legacy.
Mhm. Yeah, it's powerful. I have a part 2. I then creatively borrowed from the visuals, and I started to look at, the personal legend and this journey of a map, and it's very key to The Alchemist,
Mhm.
because
Mhm.
he goes on a physical journey to the desert and he goes to Tangier in northern Morocco, and anyways, it's a really beautiful story. So I began to see the personal legend also as a key on a map. And it's like that legend that's in the
Mhm.
corner that has these symbols that
Mhm.
show you how far along on the map are you? Is it miles? Translation from miles to kilometers. And you see trees here, there's a water body there. But I also think, the compass hasn't made its way into my character setting as often when I say this, because there's the compass too and how we navigate. So if your personal legend also is what are the keys that keep you on your path of pursuing this legend that you have
Yeah.
to foster this awareness, and what's your compass, because what guides you, and it could be practices
Yeah.
like meditation or gratitude, or it could be like anything or inspirations. Well, yeah, what are just some things that keep you on your path and would serve as that
Yeah.
kind of legend for you?
What what I really pull from is the interactions I have with my clients and
Mm,
hearing their stories and hearing their background and hearing their journey and being able to hold them for that small amount of time and hold space for them.
mhm,
And so when I think of like a compass or something like this going forward, I look at that relationship of, that energy exchange.
yeah,
And that is powerful to me. And that keeps me going. That keeps me
mhm,
going, knowing that there are more people that need space to be held for. And it's not uncommon, and as humans, we all need that. The other thing that motivates me is also being that difference in my family of this is ladies, nieces, my daughter, this is what you can do with your life. And you need to be sure you can get an education and you need to speak up for yourself. And you never back down and you
mhm,
never feel smaller than that person in the room.
mhm,
And so, like, that keeps me going, is showing and modeling that for the next generation in my family, and then knowing that there are other people that need somebody like me to hold space for them going forward.
yeah, 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 that's really good. It's, I think that's a good, powerful way of encapsulating so much,
Yeah.
and I think that is a powerful legacy, but also, yeah, the story that uh, you're sharing is one that will, like you said, instead of the shrinking back and the way that women have been encouraged or forced or even unintentionally, subconsciously, it's like, no, that you would take up space, that you would have your voice, and
Yeah.
so you carrying that message in and of itself is aspirational and instructive.
Mhm. It's that
And then,
throat chakra.
hmm,
Let it
yeah,
out, let it out,
let
let
it
it out.
out.
Yeah, for sure.
Yeah, yeah, yeah. Well, thank you for letting it out here on the Compromised to Alchemized podcast. But I want people to. I just made it cheesy. Thanks for letting it out here on the Compromised to Let us have a more elegant exit by you saying, how can people? So, how can people find you? Is there anything you especially want to beckon people towards in terms of whether there's just people who are excited about what you're doing in terms of women's advocacy, or on the myofunctional or the healthcare side? Either way, what are the ways people can
Yeah,
follow you and engage with you?
yeah. So I have My Myo My Health, which is our myofunctional practice that's local to Phoenix. We have a location in Mesa, and we see people globally online. I also have, speaking of Compass, the Myo
Hmm.
Guide,
Oh yeah.
and that is my extension of the practice in which I am uh, building that out right now. And I want to have more affordable resources for our community. So, coursework and knowledge and information for women looking at what resources that they can get to for hormonal health, for sleep and airway and mental health ultimately, and
Hmm.
then professional guidance in regards to things we don't learn in dentistry and myofunctional therapy, things that have not been promoted that should be obviously about hormonal health, hypermobility, because that is going to cross over very heavily into the clients that come into our clinics and practices. So the
Yeah.
myoguide.com and My Myo My Health, and I'm on all social media with My Myo at TikTok, Instagram, YouTube, Pinterest, you name it, I'm on there. And it's all
You're
me. Nobody else that creates it, just me.
wow. Well, that's amazing. You're everywhere. You're ubiquitous, and that is pretty amazing. And so,
Thank you.
whew, well, thanks so much. I really appreciate what we got to talk about, what you shared. I
Same.
am inspired. I know many will be. And yeah, who, when you're listening to this, Share this with somebody you know needs to hear this, or you want them to hear this. And I can't wait to hear what you think. Thanks
Mhm.
again, Kelley. You rock it, and I'm excited for more conversations with you.
Yeah, thanks, Dr. Neil. You're the best. Appreciate it.
Thank you for listening
This
to
is
the
major.
Compromise to Alchemized podcast. Really excited to thank Jessica from Lunalux for the music. This track called Major. I want to thank Toshi, who originally did the design work for my cover art. And then I also want to thank Alyssa from my team for podcast publishing, my whole team, including Kat, for heading up my world. And then also definitely want you all to follow me on YouTube, follow the podcast on Spotify or Apple or wherever you get your podcast. Comment, give us a rating, and also follow me on Instagram at Dr. Neil Bulchandani so you can stay tuned to my latest. Thanks so much, and you have an amazing day.
This is major.